Now, moving on to matters health, the government is working on modalities to reduce tuberculosis infections in the country.
Well, Prime Cabinet Secretary Musalia Mudavadi, who presided over the commemoration of World TB Day, expressed concerns over the rising cases of infections attributed to TB.
Speaking in Eldoret, Uasin Gishu County, Prime Cabinet Secretary Musalia Mudavadi said the government is putting emphasis on early diagnosis and timely treatment of tuberculosis. Mudavadi, who represented President William Ruto at the commemoration of the World TB Day, said that tuberculosis is the fourth leading cause of death in the country.
The burden for TB and HIV and drug-resistant TB remains high. We have made progress towards reducing the tuberculosis burden in Kenya through robust multi-sectoral partnerships, increased domestic resource allocation for TB programming, rapid adaptation of innovations, and global WHO guidelines recommendations.
Health Cabinet Secretary Susan Nahumicha said the government is working to make healthcare more affordable by weeding out cartels, who she said are taking advantage of the poor Kenyans.
Anajaribu kushukisha afya chini, lakini kuna wale ambao wanataka kuinua bei ya afya Kenya. Na mimi nitafanya kazi na rais, ninafanya kazi na Prime Cabinet Secretary kuhakikisha ya kwamba afya tunaiweka chini kabisa ili kila mtu akaweze kupata afya.
The acting director at the Center for Respiratory Disease Research at the Kenya Medical Research Institute, Dr. Jane Ongango, is in the meantime calling for mandatory screening for tuberculosis in all public health institutions for anybody presenting a cough to help reduce the spread of the disease.
To avoid missing out on TB diagnosis, they need to screen everybody who has cough of any duration. Previously, they used to just screen people who have cough of at least 2 weeks. But we informed them through our National TB Prevalence Survey that they need to screen anybody who presents with cough.
While noting that KEMRI has made strides in TB treatment, Dr. Rohedi said the treatment period for TB has reduced from 18 to 6 months.
Our target for tuberculosis is to make treatment much easier for the patients who have it.
Judith Akolo, Easy Friday.